Statistically, that's a fact. It's a statistical fact. The numbers bear out that the things that kill us the most are the things that we put in our mouth.
If health is a state of mental, physical, spiritual, and social well-being, a state in which the body is functioning at 100% and not merely the absence of disease, then why is it that black people are the least healthy race on the planet?
Welcome to Black Health by Evoke, a podcast where we discuss the unfair access to care, health inequality, and the cultural and generational impact of poor health in our communities.
It's time for us to take responsibility for our own health. Meet Dr. E, Dr. T, and myself, Dr. V. We want black people to be encouraged and empowered, for our people are perishing for lack of knowledge. It's time for black health to thrive, not just survive.
Good morning, fellas.
What's going on?
Good morning to you guys.
For whatever reason, we like to get on at the daybreak.
Top of the morning to you.
Crack.
I think that's
The crack of dawn.
right.
Early in the
I
morning.
think it has a lot to do with the way our life is structured, right?
Mm-hmm.
We gotta wake up before the world.
What they say that the way to be the healthiest is to rise with the sun and go down with the sun, dusk to dawn, or dawn to
I don't believe
dawn
that.
to dusk.
I don't believe it.
Hey,
Because waking up at 9 o'clock show feels
when
good.
I was in the military, we had a motto. We would get up so early. We said we get more done in the morning than most people get done in that day. We get more done by 6 o'clock than what people get done in their entire day. So that's something. It doesn't bother me at all to get up early and get some things taken care of, because now you can relax the rest of the day.
Or some of the rest.
Shoot,
Some of it.
There used to be something to brag about. Now people don't do much.
I do more in 30 minutes than what people can do in their day now.
Easily. So many people not even getting out their pajamas
For the entire day.
going straight
For the entire
for
day.
the whole day.
Go to
Get out the
Walmart.
bed, go straight to work. Right, go to Walmart, go straight to work at their desk at home, and then go straight to the couch.
Man, I think that would be a great topic to talk about one day is the shift in the workforce from leaving home to being at home and doing all the work from home.
Absolutely.
How is that impacting our health? How is that going to determine what health looks like 4 or 5 years down the road?
Right. We're going to see, because, if anybody is believing that our health trajectory is the same with everybody sitting at home snacking in front of the computer, then they crazy. It can't be better.
Yeah.
We got a little off topic, but that's okay.
Well,
because this is black health. That's
I don't know if we got off topic, because what is
I
it?
think we right on
What
topic,
is it that has
actually,
caused
man.
that shift? What was it that happened that caused that shift?
Yeah.
Right. A huge part of that, and it may have just accelerated the direction that we might have been moving in, but it definitely accelerated it.
Absolutely, man.
Was COVID-19, right? The pandemic
Definitely.
was something that it caused this major shift, right, in our culture, especially our work culture.
Mm-hmm.
Major shift, where entire companies have shut down their offices, and don't plan on ever returning back to the days of coming into the office and coming in and getting at your computer in the office. Those days for many companies are over.
Yeah.
And people are happy about it. People are happy about not leaving the house. I'm thinking about the as far as the health benefits of social interaction and the health benefits of that exchange period of being around other people, and the building of your immune system.
Yeah, well, I've heard it from both sides, Dr. Vaught. So you talk with people that are working from home, and some of them don't like it at all, and then you have some that actually love it. So I think it kind of depends on the person, maybe the type of work that they do. maybe those that are aware of how it's started to affect them, maybe from a health standpoint. Because I know I hear a lot of people
Right.
say, all it's done is made me lazy.
Yeah.
Yep.
Yeah.
And then you hear other people who actually are more
Yeah.
productive
Yes.
working from home, right?
Yeah.
They work from home, but they're getting a lot of other things done. They're saying they're spending more time with their families. They go work out. They do all of these things that they might not have done with a regular 9 to 5, where they had to drive into work in the morning and then have a commute
Yeah.
at night.
Yeah. Yeah.
So it's been different for everybody.
Definitely.
But one of the impacts we know that it's really had is it has accentuated an issue that we already deal with in this country, and that's our health issue, our overall health. Obviously, sitting all day, right? Sitting on your couch or sitting in front of your computer, can drastically impact your health. The problem is we was already doing that before COVID, and when COVID came, it really again accentuated an issue that we were already dealing with, because we look at all of these statistics about how America did, how the United States did when COVID came around, and they're startling.
It's talking about COVID has become a thing to where it's almost you have to be careful with what you say about COVID, because you have all these different. There was so much research that has been done about it, and its effects on different populations. You research all this information and you look at all these different articles, and some of the things can kind of be a little confusing in the way that it presents the information and why certain communities were affected more than others. But when we actually look at the effects of COVID on the Black community, what is it that you all see? What do you think it came down to?
Man, I'm looking at the black community, and you hit it on the head as far as it's almost like you don't mix politics and religion in your
Right.
conversation. Now they got an ad one. You don't mix politics, religion, and COVID in your conversation. Within the black community, I think a lot of the reason why the disparity is there is we can go back to two big points, and that's the education and then the health state of the black community.
Yeah. So those things. What do you mean by those things that we suffer with the most? Like, what I mean, what does that mean? Because we say that we're sicker, but I think sometimes we don't really understand what sickness is, because from our standpoint, if I'm talking about the African American community, how sick we are, or the different things that we're dealing with, say for instance like high blood pressure, just as an example, you know talking about high blood pressure in our community doesn't relate to sickness to us. You know what I'm saying? So it mostly
Yeah,
relates to, this is just something, it's part of life. It's just something that we deal with. It's
lifestyle,
it's a lifestyle.
lifestyle.
So
Yeah,
we may
yeah,
not really look
Lifestyle.
at it as, well, I'm sick if I have high blood pressure. So just kind of getting a little bit more clarity when you say we're the sickest. In what regards are you meaning by that?
Some of those things that you mentioned, like you said, high blood pressure, our higher rates of obesity, our higher rates of diabetes, our higher rates of cancer. When we look at all of those markers and all those numbers outside of COVID, when we look at all those markers and all those numbers that talk about death rates and what people die from, and the reported conditions that people suffer from when they go, that they're being treated for, right? That they're being medicated for, they're being treated for, or they go to the ER for, or they go to the primary doctor for. African Americans are the ones that are leading in just
Hmm.
about all of those categories.
and that goes back to just with a pandemic or a or something or any type of sickness that comes and kind of ravages through us. I believe the culture of people, like Dr. Everett was saying, that has the majority of the systemic diseases and disorder is going to be impacted the most, just because of their bodies already being kind of broken down from the physical conditions.
It's just harder to fight conditions, and that's really what it comes down to. Is that if your body is, like Dr. Vault was saying, broken down, it's just hard. It's more difficult to fight conditions. And one of the things that we noticed that COVID-19 was a stronger virus than many of the viruses that we've encountered, and most of the and stronger than most of the viruses that we've encountered.
Especially
Recently.
in our
So
lifetime.
what is the what? So what are we as far as
Right.
this? If we're number one as far as with COVID, there's got to be number two, and what is the gap or the rate of us as far as being ahead of just number two?
I'm glad you asked. Because it is important to know, where we stand. The latest numbers I looked at were from July of 2022, so they're pretty recent. With it now being September of 2022, that African Americans were just over about 350 deaths per 100,000, and this is not in July. This is over the course of COVID, right? So this is what that rate was from the beginning of COVID up until July of 2022. Um, um, Blacks were right at about 350. Whites were right at just below that at about 340. And Latinos were quite a bit down below that, about 260 deaths per 100,000. So, as Americans, our death rate, it was higher than just about the rest of the world. Not every single country, but we were in the top five. But that, again, it points to the health of our country, and more specifically, the health of African Americans, that makes us more susceptible. And this is something I feel like we should be worried about. They always talk about kind of the canary in the coal mine, right? They bring the canary down to the coal mine, and they know the gases are dangerous when the canary dies. That's your time to get out the coal mine, right? And so for us, I believe that COVID-19 is that canary, right? That canary in the coal mine. When a virus like this comes along, so many of us suffer from it. It's not, and people die, but also people got very, very sick. And and this canary in the coal mine is telling us right now that it's time for us to pay attention to the state of our health.
Yeah. So, and it's fun. It's important that you mention that, man, because as we look back on the effects, the devastation, I'll say devastation that COVID-19 had on our community. Also, what I think what it has done, even though, like you said, with the canary in the coal mine, we should be a little more aware of these things. And I think for a minute it did catch our attention. But now, as you can see, things are really slowly turning back to, us as a community. It's really slowly turning back to, things as usual again. So in the beginning, where that conversation was had, it was like, man, we need to start doing this. We have to start doing this. We have to take better care of ourselves. It's the comorbidities as to why more African Americans are passing away from COVID. And this was the conversation during the whole pandemic. But now, since then, that's not the conversation anymore. And my fear is, it's kind of hard to say. I think a lot of it has now been the conversation had been taken towards the vaccination. So now again, it gives us that false sense, like with everything else. If I got high blood pressure, if I got diabetes, I'm not worried because I have a fix for it. I have a medication. I have something that I can take. So now with the vaccination now being here and present for everyone, it's like for us in the beginning, it was like, oh, I got to get myself in shape. I got to start taking better care of my health. But now that we have this option, it's like, oh, well, I'm good. If I get the vaccination, I won't get sick. If I'm overweight, I should still be okay. High blood pressure, diabetes, all these different things. And that's the fear. That's the, for me, that's the issue that I have is that, what happened to this communication? What happened to the education that we were talking to people about getting better with their health and doing those things is going to help, improve your health to give you a better opportunity, a better chance at overcoming COVID if you were to become infected by it.
You know what? I'm listening to both you guys, and I don't even if the audience or the viewers are getting this. You know, one of the things you said, Dr. Everett, you said we got to care about our health, and then no, we got to take more of a initiative of making sure we're preserving our health. And then Dr. Tipley, you were talking about we got to work out and we got to make sure we're doing this because now that people are more engaged in being healthy. But you know, then the vaccine comes out and that's the way out. Now all of us know that we got 2,000 years of research of viruses out there and their impact. Although this is a man-made virus, we got 2,000 years of this research, but yet and still people laugh about the COVID-20, not the college 20, but the COVID-20 that they put on when they were in their house. And they talk about, yeah, you know, my question is the reason why we maybe our number one in disparity as far as in COVID is not that we're more prone to it, but we've been almost conditioned not to care because we are the highest in every other disparity. Do we just not care and have the expectation of always being the sick or the one that's going to be the most impacted or affected?
You know, like with those numbers that Dr. Everett gave is, you know, you give those numbers to anyone and they're going to look at it and they're going to be like, man, you know, that those numbers in reality is not how, when I look at those numbers, you know, and you look at the percentage, is not that high. But when you just give the straight facts, okay, 350 people in out of 100,000, when it comes to a black person, like Dr. E was saying, you know, that raises eyebrows. It causes concern. But the point that he was making, why is that number like that as being compared to other races? And man, it really came back to, like he was saying, with obesity. So even with the COVID-20, we put on extra pounds, but like he just said, if our rate of dying from a virus or something like that was due to let's just say obesity, being overweight, period. How are we okay with it? Or how does a vaccination make it okay to continue to move on being obese or being overweight?
But are we obese or are we thick? Like, so it's I need to really clarify because I didn't get that answer. Do we care? Do we care?
Right. And yeah, and you know, like, do we care? Yes. I would say yes, right? But caring and doing something about it are two different things. Those are really, really two different things. Yeah, you can care, you can stress out about something, but are you going to do what it takes in order to solve that problem? And I think that's where we run into the complication and asking that big question. Why don't we do something about it? One of the things I say, and Dr. Tip heard me say this all the time, we have Google. All the information you ever needed about anything that ever existed in the history of man, you can find in about 10 seconds nowadays. It's amazing. You guys should check it out, man. It's this thing called Google. And so when people are not mystified about how to lose weight, right? They're not mystified about how to get healthy. That's not information that they're lacking. Now, there's some details in health I think African Americans are lacking in information, but just how to get healthy, the basics of how to get healthy is information that we're not lacking. So then the big question and the big why is, why don't we do something about it? Why do we put ourselves in a situation to be the most obese in this country, and then when the virus comes along, be the ones to suffer from it the most?
You know, I think I'm gonna try this. This would be my response to that. Okay, so it is a tough question, but I'm gonna take a stab at it and say this, man. Looking for help. I think a lot of times when you look at certain aspects of our community, it's we see problems. Some of the problems we cause ourselves. Some of the problems we feel like we have no control over. But when we face those problems, rather than looking at ourselves, a lot of times we look to the outside for help. So now, if we're looking to the outside for help, we're talking about public policy. We're talking about things changing from a socioeconomic standpoint. We're talking about things changing in our community, access to certain things. You know, all these things that can put us on the right track if we were to take control of it ourselves. But I think the problem is we start to look to the outside for help, and you know, frankly, just to put it plain, the outside is not really concerned about what happens within our communities, how our communities fare with certain things. Yeah, certain carrots and certain things are dangled in front of us, but for the most part, it's still not structured in a way to help um, to really put it in a sense to where it would help a community to really thrive if the community is not doing it themselves.
So in essence, we with Google and trying to look outside of our community, we need to be responsible.
Basically, we have to start being more responsible. But again, I think the thing is we start to look for, you know, what kind of assistance can I get? What kind of help can I get? You want me to do this? How can you help me? What can you give me?
Yeah, and I think I'm typically, always on the personal responsibility train, right? That's the thing I love to focus on the most. But a recognition of circumstance is always important, right? Because recognition of the entirety is how you get to solutions. And our culture, we're very unique as African Americans when you look around the world, right? Because we're a very young culture. We're very young people, basically, relative to the rest of the world and all these other cultures, right? They've been established for thousands of years. We've been established for hundreds of years. So our culture is still in its infancy, and in that infancy, one of the things that has really been ingrained in us that we really have to work on is that level of dependency, right? Everything has been structured for us to, like you said, look to the outside and look for help, and it's been very difficult. And I think there's movements and things are happening, in the direction that we've seen over the past maybe 10 years. And then we saw in the '60s, right? We saw in the '60s, and then we've seen over the past 10 years where we're talking more about doing things ourselves and taking care of ourselves is the only way that we're going to get to where we need to be. But I think that a recognition of things being the platform being set, that we needed to
Right.
depend on the government, right? We needed to depend on others in order to get the things that we need, the social services, the economics, right, the education, all of those things coming from somebody else, from the other,
Right.
in order to take care of us. And that's something that I think we really
Exactly.
have to mature out of with our culture. Like I said, being in its infancy is something we have to mature out of, and it's something we have to be open and honest about. We have to be open and honest about the fact that that this been so ingrained in us that when we go to the doctor, we just, whether it's your medical doctor or your chiropractor, the expectation is that your medical doctor, your
Right.
chiropractor, is going to solve your problem. I'm gonna tell you from personal experience and being a chiropractor for nearly 20 years, is that idea is way more common in our culture than I see in other cultures. That I'm coming to you to fix me, right? I'm coming to you to fix me, and I don't have to do anything. I shouldn't have to do anything. And if you're asking me to do something,
Right.
then you're not a good doctor, right? And that is the thing that I think that is one of the things that we really have to grow up
You
about.
know, it's funny that you say that because I noticed just in practice and even talking with other doctors, when practice members do come in, some of the things that they want to do is they lay it down on the line, and They don't ask many questions. They just, hey, whatever you do, hey, but you need to fix me. And then when I see other cultures, they'll come in and they'll try to tell you what to do to them as being the doctor, and you like, hey, wait a minute now,
They're more in
shut up.
control.
So like I got this. Like I'm the doctor today, okay? So, but even with COVID though, one of the things that I did a podcast with COVID. It was with a emergency room doctor. It was with an organ transplant doctor, and it was another a virologist. All of them were in different states, and all of them were African American. And one of the things that they said with they noticed with their African American patients when they were coming into the hospital and they were checking on their relatives or their loved ones that were dying or passing away, one of the things that they were saying is none of them asked to see the charts. None of them asked about the procedures. None of them said you're not going to hook them up to this machine. None of them said no, we're not going to take this medication. Because the host actually was one that said you're not going to put my mother on this breathing machine, and she pretty much saved her life. So what do we need to do as far as within our community to combat things like COVID, as far as action steps or when a pandemic of this magnitude comes up to ensure our safety and that we thrive?
I mean, I think it's a.
I'm
You
still
go ahead,
thinking.
Doc. Go ahead, Doc. Okay, because I think it's a couple of things. It's like this mosaic, right? It's a bunch of different things that have led to us being in the situation that we're in. It's a bunch of different things. It's a couple of different things that can solve that. I think what it all boils down to is lifestyle.
Okay.
Right.
Lifestyle.
And lifestyle. But and when I say that, what I mean is we have to be direct in solutions, right? So there's no 100% solution. But when you see a solution staring in your face that's going to solve 85% of the problem, then that's the one that you have to address, and that's the one that you have to put the most energy into. Us getting healthier, us losing weight. 78% of those that were hospitalized or died from COVID were obese, period. 78%. So the problem with the pandemic was that we fat as a culture. That was the problem with the pandemic. It was not just that COVID-19 showed up. It was that COVID-19 showed up with us being in the state of health that we're in. When you put those two things together, now you create a pandemic, right? That's how you create a pandemic. Because to be quite honest, from a numerical standpoint, there were many countries that did not suffer a pandemic. They didn't have these huge numbers of people dying in their countries. And you can look directly to the overall health of that country to find the answer to why that was the situation. So when we're talking about solutions, losing weight is not the 100% solution, but it doggone sure is most of the solution. And I think that's something that we have to be squarely focused on.
I don't think I could say it better. For us, we have to want to live, man. We just have to really make a conscious decision to want to live. And wanting to live, you have to put all these other factors into perspective. You have to look at yourself in the mirror. That's what we have to start with. We have to understand what these chronic illnesses that we've made okay in our community. We have to understand that those things are not okay. When we look at our children and we see the path that our children are coming along, that can't be okay. Because if we can't change ourselves, we can definitely start changing what the next generation looks like. Because if we don't, then this problem continues to get worse and worse and worse. And that's what we've been seeing, because Dr. Everett mentioned, I remember looking at pictures of blacks in the 60s and 70s, and you rarely saw
Mm-hmm.
overweight black people. And so my question is, when we talk about the foods that we eat and all this stuff, and why we may have this gut, and why we have these thick thighs, and like Dr. Voss said, are we overweight or are we just thick? Hey, it can be a combination of both. You know what I'm saying? But when you look, when I would look at pictures of blacks in the 60s, much different looking people than what you see now. If you look at pictures of people from 5 years ago, 2 years ago, man, you see the trend, and you see most of the people in a picture, in a family picture, are overweight. It's in my family. I see it all the time. And so those are the things that we're not paying attention to. So the generational thing that continues to happen, it's continuing to get worse. So if we, then our generation, we start putting on the pounds later on in life. Now the next generation, they're putting on their pounds at the age of 2, at the age of 3, 4. So now the things that we start to suffer with the high blood pressure and the obesity and the diabetes that we start to develop in our 40s, 50s, some in their 30s, now our kids are starting to develop those things at 2, 3, 4 years old. So this only gives it only becomes worse if we don't, hopefully we have somebody's attention with what we're talking about now, but now is the time that we really have to start making changes for ourselves, because looking on the outside for help is not doing it.
You know what? And Tipple, I was
man.
thinking about what you were saying about those pictures of those people, even the ones that were overweight back then, it was a solid, more healthy. It wasn't big bone. I mean, it wasn't thick. It was big bone.
And I would say
You
that
know,
I
like,
would say
it
they were
was-
thick. You know what I'm saying?
You say what?
Physically thick,
Right,
fitness
right,
thick.
right.
You know,
The physically thick, big bone. We went from big bone to thick.
This is the reason. This is the reason Black Health exists, right? I believe is to squarely address our issues. Because so many times I hear so many excuses, and while we're making excuses, we're dying, and that's just the truth of it. That's the fact of it, right? While we're making exceptions, while we're blaming, while all these things are happening, we're dying. And so I believe Black Health exists in order to squarely address our issues of health in an honest way. The other thing I want to say is, so many times when we get on this conversation of health, and specifically when we get on the conversation of obesity, people get offended. People get offended, right? Like you're talking about them. And one of the things, the point I want to make is there is a distinct difference between beauty and health. We are not having a beauty conversation. We are not having a body positivity conversation. We are not having a conversation about judgment. We are simply having a conversation about health. And science has not changed because the culture has changed. Science still say the same thing. If you're 50 pounds overweight, you're more likely to die. If you're 70 pounds overweight, you're more likely to die. Doggone, if you're 20 pounds overweight, you're more likely to die. That's the way the body works. That's the way the health works. And that has not changed simply because the culture has changed and we become more accepting of some things, which is fine with me. And that's great. You can be beautiful. You can be beautiful at any size, but you can't be healthy at any size.
Come on.
That's
a word right there. That's a word right there.
You can't be healthy at any size, man. Yeah. And that's just science.
And something that's I looked at that, and as far as just obesity in itself, and we talking about COVID, but obesity in itself, if you think about the 70-year-olds and the 80-year-olds that you see walking around, how many of them do you see walking around that are obese? Now you may see some 50-year-olds. And you'll see some 60-year-olds trotting around too. But 70 and 80, you're not seeing them walking in the mall. You're not seeing them nowhere where there's not a bench.
No, you're not. No, you're not. When was the last time you saw a 75-year-old overweight person?
Laying in their bed. unable to give up. It's not funny, man, but that's
Yeah,
It's not funny.
because
right.
that's the only way you're gonna see them. And if you see somebody, they are the very, very rare exception. The very, as a rule, right? You don't see older people overweight. You just don't. You don't see people in their 70s and 80s that are overweight, right? When was the last time you was watching the news and they did the little thing where Miss Judy turned 100 years old today, and they got the party and they got the cake, and she 50 pounds overweight,
Never.
right? You
No,
don't
never.
see that. You don't see it. It don't, because it don't exist. Because the heart simply cannot handle that amount of weight. Your blood vessels simply cannot handle that amount of weight. Your kidneys simply cannot handle, like, your body cannot handle that amount of weight for that long of a period of time. That's anatomy. That's
And if your
science.
body can't handle that weight, how can it handle a pandemic and then your immune system and systemic diseases and disorder? And this is some of the things that are extremely impactful, and the reason why something like COVID is able to run rampant through our community. And like you said, Dr. E, responsibility.
Mm-hmm. Yeah, because there will be other viruses, right? There will be other infections. Well, as a matter of fact, let me not say that. There are other viruses, and there are other infections that affect us significantly more than COVID-19 has, right? But we just dying from them every day. It's just become commonplace, and we've just decided to accept it. Like Dr. Tipler was saying earlier, we just decided to accept it as part of the culture. Part of African American culture is you get diabetes when you're in your 50s.
Yeah.
You get high cholesterol when you turn 60. You get arthritis when you now shoot 45. Right. So we're just accepting these things in our culture. And, I think we here because we don't accept these things. We don't accept it.
Wow. It almost makes you think
Amen,
we're the
brother.
strongest,
Amen.
weakest
Amen
race.
to that.
We're so strong, but yet we're so weak.
Right.
I mean, and when I say strong mentally,
Right.
we're very strong people. There's a lot about us that makes us strong. The things that we've had to overcome, the things that we deal with. Even going through this pandemic, we still come out with a a spirit and just a drive in us, but yet we're so weak to give in to those things that we have most control over. And I think that's what troubles me
Yeah.
most. And so for anything, the last thing I would say is, we have to stop. We have to stop waiting for someone else to give us what it is that we have been blessed to go out and get ourselves. And that's
Right.
health.
I agree, man.
And listening to
Yeah.
you, Doctor Everett, man, and when we're talking about just talking about, there will be other viruses, there will be other diseases and disorders, and us being in an infancy stage of our culture, being in an infancy stage, there's a system that we've been put in to kind of pigeonhole. But I think with responsibility and then us looking from within, I think we can topple any system or systemic demand within our community.
Yeah, I agree, man. I think it's okay to be upset and to be mad and to be hurt about things that have been done to us, and be upset and be hurt and be mad about things that we're doing to ourselves. We can do both of those things at the
Mm-hmm.
same time, right? Right? We can be mad about things that have been done to us and do something about the things that have been done to us at the same time as we do something about the things that we do to ourselves. Like, it's okay to have both those conversations at the same time. But if we want to get to solutions, the fastest way to get to solutions, like Dr. Tipler keeps reiterating, is for us to take care of ourselves. That's the fastest way to get to solutions that we really need. Because no matter how mad or upset we are about our history,
Right.
we still dying. At the end of the day, we're still dying every day. And we can address the things of our past, or and address the things that are going on right now. And when we're talking about right now, and when we're talking about the effects of COVID-19, and when we're talking about what's going on in our culture, our health is paramount. That's our fight as African Americans. That is our biggest threat. You know, I know how much you guys love some of my posts on social media, but one of the things I posted was, racism and the police are not our biggest threats. Cheeseburgers are. Statistically, that's a fact. It's a statistical fact. The numbers bear out that the things that kill us the most are the things that we put in our mouth. And so if we want to solve problems, we have to look at the facts and begin to address those actual problems, because ain't nobody making you eat macaroni and cheese 3 times a week.
Well, I guess that says it all.
Thank you guys for that. Thank you guys for being riding along with me on that train.
But I like that about the cheeseburgers. That was good.
Right. So we appreciate it, fellas. I mean, we're always trying to, to push the boundaries and to answer some questions and to pose some much needed questions as we move forward. Black Health by Evoke is to challenge ourselves and really address some of the issues that we're currently dealing with. So I always appreciate you guys.
Appreciate you guys. Appreciate all our listeners. Hey, continue to tune in to Black Health by Evoke.
And definitely share. Please share with someone that can definitely benefit. Hearing this information might spark a fire in somebody to really start a charge toward having a high state of health and a Thrive lifestyle by evoking Black Health. Thank you so much.
There we go.
Thank you for listening to Black Health by Evoke.
He who has health has hope, and he who has hope has everything.
You can find us at www.evokingblackhealth.com or all social media platforms at Evoking Black Health.